I'm a gynecologist and Claire's a physio, and having recently been through the process, we've got some top tips when it comes to postnatal recovery. My first tip to think about and be aware of is about bleeding. So it's very normal to bleed no matter whether you have a vaginal birth or a C-section birth. You will definitely bleed. The bleeding will usually be heaviest on the first day after birth, and it should get progressively less as the days go on. What I would suggest is bringing in with you the thick maternity pads. Don't buy the kind of normal sanitary pads, even the heavy ones, because what you might also want is the extra cushion, the thicker pads if you have any tears or stitches down below. Expect the bleeding should get steadily less each day. If it suddenly gets heavier again after a few days, or you start passing bigger clots, you should go back to see your midwife or your doctor. And then after the bleeding all stops, a common question I get asked all the time is, when can I expect to see my period again? And now this will depend on whether or not you're breastfeeding. So if you are breastfeeding, you may not experience a period until you stop or you wean down the breastfeeding. So you're giving some feeds either as bottles or you're feeding less overnight. I've got a blog post, which I'll link in this as well, about what you can expect from your periods when you're breastfeeding. And if you're not breastfeeding, it usually will be between 3 and 5 weeks you'll see your first proper period. So it might actually be, if your bleeding goes on for a couple of weeks, you only have a week off and then you start bleeding again, but that might be your period. If in doubt, chat to your midwife or your GP and they can always help you.
Second tip is about pain. So obviously, however you have your baby, whether it's cesarean or vaginally, you're going to experience some pain. And I think sometimes the misconception is, if you have a vaginal birth, that even if you have just grazes, you won't have much pain. But sometimes grazes actually cause more pain than anything else. And I think it's remembering that pain can last for a number of weeks. So there is no problem in taking the painkillers, because actually sometimes you think, oh, I'm feeling great this week. It's been maybe 10 days now. I'm feeling loads better. You take all the painkillers away, and then suddenly the pain gets on top of you. And the worst thing I think is chase pain. So keep on top of it, keep the lid on. Other things that can help with pain. So with a C-section, actually gentle movement can help. Obviously not doing too much, so don't kind of boom and do loads and then do nothing. Regular movement. Staying in one position for too long actually increases the swelling, and it's swelling that causes a lot of the pain. Ice can help. So we don't recommend that, say, on the C-section, but vaginally, like a clean sanitary pad or a maternity pad, as you mentioned, wet it with water, freeze it, flannel around it, pop it there, 5-10 minutes, it will feel amazing.
Patsicle?
Yeah, little patsicle. And it will just really help with some of that discomfort. Keep on top of the pain through lots of those different methods.
Third top tip is around looking after your wounds. So you're very likely, whatever type of delivery you had, to either have a wound in your tummy if you had a C-section, or wounds down below. So the first thing with any wound is allow air if you can. So what that means is, when you get home after being in the hospital, natural tendency, you have loads of visitors over, everyone wants to come and see the new baby, but actually that's not helpful. What you need, if you've had a wound down below, is to be able to let the air get to it. Take your knickers off and sitting with your legs up. If you've had a C-section wound, after 24 hours it doesn't need to be covered anymore unless you've been given a very specific type of dressing. As long as it's okay, usually that comes off at 24 hours. So let the air get to it as much as you can. So maybe certain visiting hours that people can come over, the rest of the time sitting out with your legs up. Exactly. When you are washing yourself, don't use any soaps or anything down below or over your wound. Just wash it gently with water and pat it dry. Don't rub the wound, because you don't want to risk breaking up the stitches. Once your C-section wound is fully healed over, so you can't see any kind of red raw areas, and you're still getting some pain in the wound, you can try some gentle C-section wound massage. And I'm sure you might have some tips on wounds from episiotomies and things.
Yeah, so it's the same principle within the vagina, and actually wounds vaginally can get very tight, and that can restrict your pelvic floor, because anything that's kind of more than a skin graze, so second degree tear episiotomy up, involves muscle tissue, so that can make the muscle quite tight with a scar in it. So actually massaging down in your pelvic floor, similar to perineal massage that you would have done before you had a baby, just getting those tissues moving can actually help your pelvic floor activation afterwards as well, rather than being restricted. Also, if sex is a bit uncomfortable or you feel some soreness, remember, scar tissue is brand new tissue, so anytime that's then touched again, say in sex, it can be very sensitive, but massaging it sort of desensitizes it, and that can really make a difference. So if sex is painful for you or just uncomfortable, then try some perineal massage, and that should really help.
Yeah, a lot of people do ask the question, when can I begin to have sex again after having a baby? I think we generally advise around 6 weeks for everything. worrying when it comes to this stuff, and that's just to allow fully all your wounds to heal. And often you don't feel like it anyway, and I think it's nice to give yourself a bit of that time. You could start earlier once all the bleeding has settled down completely, if you feel that you're pain free and you really want to try to have sex again, but do expect it to be uncomfortable the first few times, and try some of the tips that Claire mentions.
So fourth tip is getting moving in general. So really it depends on your birth. We expect the women who've had a cesarean section, it's major surgery, they will take a little bit longer to get moving. But again, it's about little and often. So the first week, if you're wanting to get out from the first week or two, just round the block is a really good tip. Remember, you are taking painkillers which will be masking some of what you are feeling. So it's very tempting to think, I feel a bit like Supermum, and you're like, right, I'm going to go out for that lovely walk. And especially if you've had a vaginal birth, you're thinking, okay, it's been uncomplicated maybe, I've only had some grazes. But remember, your vaginal area is still more open, your pelvic floor is weaker, you're still being upright, you're very tired, you're depleted. So it is about little and often. So again, walking is a great place to start. Often ask, when can I start my pelvic floor within that? So you can start your pelvic floor on the day of delivery once you've done your first wee, we say. So if you've had a catheter, you've taken that out once you've done that first wee, or if you haven't had a catheter, once you've done your first wee, you can start doing your pelvic floor exercises, again, within comfort. So much of it is just listening to your body and not pushing it too far. I'm a big fan of walking, but I'm not a big fan of like an hour of walking at week 3, because often you feel great and then you do too much and then you pay for it maybe for the next week or so. And especially things like baby wearing are amazing, but you've got to remember, obviously, if you've got a C-section scar, that's a lot of pressure. If you've got a pelvic floor wound, adding any weight to your body is putting pressure down on your pelvic floor. So again, you can end up doing it for just a bit too long because you think you're feeling better. So moderation for sure. And then building in things, you can start, if you want to get on a static bike, around 4 to 6 weeks. And again, you've had an uncomplicated delivery and you feel confident, you can introduce that in, doing some body weight squats or some body weight lunges. Again, I think a lot of the time is finding time, energy and space for these things. C-sections is different, it's a major surgery and you really need to let that all heal. But again, a good place is the pelvic floor, the deep core connection, and just getting yourself mobile very slowly. Those are my top tips.
We finally wanted to just talk about your bladder and your bowels. When you go for a wee after giving birth, expect it to be a little bit sore down below. Taking something like a cup of water with you when you wee and pour it over yourself should give you some relief. If you're finding it really hard to pass the first wee, for example, if you had a catheter, elevating your legs, putting them on a step or something to raise them up a bit can help. Give plenty of time, sit on the loo for ages and ages, just let gravity do its job. Run the taps on.
Taps on really does work.
And then bowels as well, so important to look after your bowels after having a baby. And again, we always neglect ourselves. Once baby's arrived, no one really cares about the mum. And that is one thing that you've just got to kind of pay attention to, try to remember, because avoiding constipation will help any type of wound healing. It will help your perineal wounds down below. You don't want to get constipated and start straining, because that can put pressure on those stitches. Same with your C-section wounds. You just want to try to keep things moving regularly. And if you need to, don't be afraid to ask your doctor or your midwife for some laxatives to help. And that is even for a few weeks. And also the effects of the hormones changing. You may alternate between being constipated and having diarrhea and that sort of thing, but just trying to avoid constipation wherever you can.
Absolutely. I think I forget how much I need to drink when you're feeding. I don't have time to go to the loo if I'm drinking 3 litres. It's a lot of fluid to try and get in, but it is essential for your bowels. And I think we forget that the bowels are what allow us to reabsorb water into the body. So if we are dehydrated, your bowels, that's why you get more constipated, because your body's trying to keep that water in your body so you can feed your baby. But it's tricky. Mum life is tricky.
So hopefully those tips are useful for you. Leave any comments of any tips of things that you found helpful after you had your baby. Bye.